All right, let's dive into a topic that, most people, and especially men, tend to avoid: pathologies of the male breast. But look, ignoring it doesn't make the risk go away. So in this explainer, we're going to break down the essential anatomy, the common conditions, and the absolute red flags for cancer, all based on our source material.
Our source opens with this, wow, this incredibly powerful and provocative statement. It immediately sets the stakes. It really underscores why understanding this topic, even though it's rare, is so vital. It's just a stark reminder of the emotional and physical weight that comes with this diagnosis.
So to really get a handle on the pathologies, we have to start with the fundamental biology, right? Because the male breast isn't just some less developed version of the female breast. Nope, there are key anatomical differences that literally dictate what can, and just as importantly, what can't go wrong.
Okay, so here's the absolute key difference. And it's simple, but it's profound. Male breasts lack proliferated lobules. That one single anatomical fact is absolutely crucial. Because men don't have these structures, they just aren't susceptible to some common female breast pathologies that come from them, like fibroadenomas or lobular carcinoma. This just fundamentally changes the entire diagnostic landscape for men.
With that foundation set, let's talk about the single most common issue men face with their breast tissue: gynecomastia. You've probably heard the term, but we're going to get really clear on exactly what it is, what causes it, and how it actually presents itself. So, here's the most important point. Gynecomastia is a non-cancerous enlargement of the actual glandular tissue. I have to stress this, it is not about fat. It's about the underlying structural elements of the breast itself actually growing. When it comes to this, context is everything. Gynecomastia is actually considered a totally normal physiological thing during the big hormonal shifts of adolescence and, again, later in life. But if it shows up between those ages, it's considered pathological. It's often linked to other causes, like certain medications, marijuana use, liver cirrhosis, or even as a sign of something like testicular cancer.
And gynecomastia isn't just one thing. It can present in a few different patterns. The most common is what's called nodular. That's the acute stage, it's often tender, and you find it right behind the nipple. Now, if it becomes chronic, it can progress to this dendritic or branching pattern, which is more fibrotic. That just means the tissue gets more dense and tough. And finally, you have the diffuse glandular pattern, which makes the tissue look a lot more like a female breast on an imaging scan and is typically seen in men who are undergoing estrogen therapy.
It's also really important to be able to distinguish true gynecomastia from what we call pseudogynecomastia. Remember, true gynecomastia involves that glandular tissue creating a distinct, palpable mass right behind the nipple. Pseudogynecomastia, on the other hand, is simply an increase in fat tissue. It doesn't form a discrete lump, and it isn't centered on the nipple. A totally different thing. And here's a pretty reassuring fact from the source. If a man feels a lump and it's not gynecomastia, what's the next most likely culprit? A simple lipoma, which is just a benign fatty tumor. This is really important to keep in mind. Not every palpable mass is something sinister.
But of course, sometimes it is. And while male breast cancer is rare, the problem is it's often diagnosed at a later, more advanced stage. So now we need to shift gears and talk about the red flags for malignancy. The first, and maybe most significant piece of the risk profile, is age. Male breast cancer is overwhelmingly a disease of older men. The average age of diagnosis is right there at 70 years old. What this means is that for younger men, while it's not impossible, the risk is exceptionally low. And that's a crucial factor to consider when you're thinking about any new lump or change. The genetic link is also incredibly strong. Think about this. About 1 in 4 men diagnosed with breast cancer carries a BRCA gene mutation. And specifically, it's the BRCA2 mutation that's more commonly associated with male breast cancer than BRCA1. That is a huge piece of the puzzle.
Beyond those well-known BRCA mutations, there are several other conditions that can significantly raise a man's risk. Klinefelter syndrome, which is a genetic condition where a man has an extra X chromosome, is a major one. And then you have conditions that can alter hormone balances, like cirrhosis of the liver and chronic alcoholism. Those are also well-established risk factors. So what are the warning signs you really need to take seriously? Well, unlike that central lump you get with gynecomastia, a cancerous mass is typically eccentric. That means it's off-center from the nipple. It's almost always on one side only, it feels fixed or immobile, and it might be accompanied by swollen lymph nodes in the armpit. These are the features that demand immediate medical attention. Okay, so all of this, the risks, the warning signs, it all leads us to one final, very practical question. Given these risks, should men be actively screened for breast cancer in the same way that women are?
The question is pretty simple, but the answer, well, it's complex. Should screening mammograms be a routine part of men's health, especially for those guys who have known risk factors?
Now, the source material answers this with a very provocative argument. It points to the ongoing controversy around screening, even for women, citing debates you can find in places like the New England Journal of Medicine. The point here isn't to just dismiss screening, but to highlight that there's a really complex medical debate about balancing the benefits of early detection against the potential harms of overdiagnosis. And that's the context for the final recommendation for men.
And this brings us to the final takeaway from our source. For the average man, the risk of breast cancer is just considered too low to justify the potential downsides of routine screening. The recommendation is clear. Screening should only be considered for men with very specific, high-risk conditions like Klinefelter syndrome. And that leaves us with a final thought. For most men, the most powerful screening tool isn't a machine. It's awareness. It's knowing the specific warning signs we've just covered.